Hey, good morning and welcome back to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney here as I'm with you each and every weekend at this time on Saturdays at 10 here on Talk Radio 1320 WJAS. The show began last week, and I've really been looking forward to having an opportunity to meet a whole new group of people that listen to this particular station, and hopefully as the weeks go on, the numbers of you who continue to listen will mount up and get greater and greater with each advancing week. I have, however, done radio shows for quite a number of years, 17 to 20 years, somewhere in that range. I've even lost track of it. And I got to tell you, there's really an advantage from starting out fresh once again. So the change over to this venue means I get to start with a perspective I didn't even have before. For all those radio shows for all those years, I sort of brought the message as I learned the message. I didn't even know what I didn't know. As I look on it now and begin a new way of bringing messages to you, I feel that starting at the beginning square and making little steps each and every week to build this thing to a point where your understanding can gradually grow gives me this opportunity to do what I never could do before. I like starting out fresh. I like beginning a new show and starting with these baby steps that I use each and every day in my office as I work with the patients who consult with me. Now, last week, the first of these baby steps was to discuss why, in fact, you might want to consider being managed by an alternative medical doctor. Now, I emphasize the word medical doctor because I really do feel there are advantages to a trained medical doctor who is able to pursue different concepts outside of the training I received while obtaining my degree as a medical doctor. One thing I think I'd like to get established right off the bat, and for some reason, the public appears to feel, well, I'll put it to you this way. I'm often asked what I do. And I say, well, I treat integratively, I treat alternatively. If I tell you that at least 99 out of 100 responses to that is usually, oh, you must use acupuncture. And I look at that individual and I just get in my back of my mind going, how did he ever make the jump between a medical doctor and acupuncture? And to be quite honest with you, I am trained in acupuncture, and I rarely use acupuncture. Acupuncture is a tool that has a specific benefit to its use, but I find there are so many other greater benefits that I rarely call upon that, again, except in the rarest of cases. So alternative doctors don't necessarily use acupuncture at all, and I can tell when I'm confronted with an individual who has made that association that I've got my work cut out for me. So starting the new show here and answering the question, should I be managed by an alternative medical doctor, I hope I've been able to erase at least the first of the misunderstandings, which is there really is no relationship between a medical doctor who practices alternatively and the use of acupuncture at all. It's just one more skill of many that could be pulled upon to help any individual get out of their particular medical conundrum. One thing I would say about the medical doctor that affords him an opportunity that no other form of practitioner does is the use of pretty sophisticated scientific laboratory analysis as well as sophisticated studies. These are studies that are used each and every day in the regular practice of medicine, and they certainly can be called upon to aid me and assist me in, number one, assessing where you stand as we first meet, and have a way as following you as time moves on to chart your progress and what you achieve, the goals, first the initial goals and then the ultimate goal of attaining your optimal health once again. You can't really circumvent all that science and wouldn't want to circumvent that science when it's so highly necessary in determining objectively where you are and where you're going. The difference between those tools, those assessment, and what gets done with them has to do with the tools available to the person that interprets them. Your medical doctor has one set of tools. They are the very drugs and prescriptions that he writes to help correct the symptoms that you've brought to him. In my particular case, I don't write for prescription drugs, and I don't write for medications to remove symptoms at all. My intention is to use the skills of the laboratory and of the study, yes, to find out where you are, but to chart my progress as I begin to repair and fix that which is wrong, and ultimately allowing you to emerge from the other side a much better, a much healthier, a much more vibrant individual who needed no meds to get there, but did need the expertise and guidance of a medical doctor trained in utilizing those laboratory and those sophisticated studies, but enabling me to use a different set of tools, a set of tools that was never made available to me in my training as a medical doctor. And so when you've given up the use of writing the prescription for a drug and taken on the responsibility of actually correcting a problem that's led to a patient that's in a little bit of harm's way, you've done a quite remarkable thing when you reverse that condition and allow this person to chart and move on into that optimum health arena that's been so elusive and has eluded that individual for some time. So we start fresh. We start with the baby steps. We did discuss last week why it was that we thought maybe you could benefit by having your medical condition managed by a medical doctor, trained alternatively. And so this week we start when I believe the next step, the next baby step in the process. And that happens to involve what I refer to as the plan. There is a plan, folks. There is a method to the madness. There is a starting point in treating every single patient that enables me to gain a footing on what, and as I learn what becomes needed, the plan begins to emerge that can be specific to that individual. But this plan follows 3 distinct prongs of attack. And they are the basic 3 prongs of attack that I use at the beginning of each encounter with every new patient that I ever meet. Now, here they are in general, and then I'll break each one of these down in specific. But the 3-pronged treatment approach consists of, number 1, determine what deficiencies exist in this particular individual. What is it that's lacking here? What vitamin, what mineral, what nutrient has been in short supply for now so long that the very tissues that require it in order to function properly can no longer function again? It's this lack of functioning that's going to lead to an organ system that's not working right, a cluster of organs that don't work right, and you're tipped off to the fact that things aren't working right by having an unpleasant symptom creep up in front of you. However, the cause for that symptom had many, many years in the making. This symptom, more than likely, at least in part, is due to what you've lacked in your own diet in terms of vitamins, minerals, and many other nutrients, and my job is to find out what they are and replace them. It's the first step on getting you back to a road of success that without it, you can't ever achieve that optimal health that you might be searching for. The second component of this 3-prong approach is the identification and the correction of toxicities. It's sort of the opposite side of the fence, right? Sometimes you got too little of something, and those too little of somethings add up over time and don't allow tissue to function properly. in the same way of thinking, however, what if you get too much of something? And what if those too muches of something happen to be the toxic elements in your environment and your surrounding? And the tissues that take up these toxic elements ultimately get so saturated with those toxic substances that they don't work anymore. If that's the case, and I'll tell you that it is the case, and no matter what disease, your toxic exposure of a lifetime finally comes home to roost as you age and begin to demonstrate the diseases of your mortality. So, to get the deficiencies isolated and correct them, and to remove the toxic substances that are interfering with the correct functioning of tissues, these first two prongs of attack require me to make that as the starting point in trying to find out how best to help you. One thing for sure, as you age, and I guess maybe a better way of saying it, when you are in your 20s or in your 30s, these, in quotation marks, immortality years, where you really don't have medical issues to any extent, you never think about what deficiencies and toxicities may lie in store for you. But they're building up over time. And the one thing you can say for certain is before you finally leave, before you finally exit this good earth, the impact of all of those deficiencies of a lifetime and the accruing of all those toxic substances of a lifetime are going to weigh in. And they are going to provoke the diseases that ultimately will make those elderly years uncomfortable and potentially even miserable, and they need to be reversed so that there's quality time in front of you, not agony time in front of you, and those two places to start are where we do begin. The third component is a component that I think is, in my opinion, highly unique. You see, I don't think there's an alternative medical doctor in the country that would ever miss identifying your deficiencies and removing your toxicities. That pretty much goes with the territory. By the way, I should add, those two items can never be corrected by your family doctor who's not trained in identifying them and not trained in correcting either of the two. His training is in the use of drugs and drugs only. And it'll take an alternative doctor to delve into what deficiencies and what toxicities you may bring to the table. But as I commend every one of my colleagues across the country for being right there to help people get a hold of these two arenas of concern, it's been oftentimes whimsical to me to learn that they very rarely, if ever, deal with this third component. It's a third rail in my office. It's a key add in to the other two that I talked about, and that is this concept of perfusion. Perfusion's the key, folks. You better have a blood supply going to the recesses and crooks and crannies of your body that enable you to transport the nutrients that we're going to try to get into these parts of the body. A blood flow is what gets them there. The greater the blood flow to each region of the body, the better off that area of the body is going to be with receiving these deficiencies items. And on the other side, whatever toxic elements need to be removed from the body, they're going to be able to have that movement facilitated by an adequate blood flow. Perfusion is the missing link. Perfusion is the missing key, even in the alternative world, and it's something that never gets missed in my office. So this interplay between deficiencies, toxicities, and perfusion is my starting point, where I need to begin with each and every patient that I ever meet. I will tell you there are some pretty sophisticated ways of assessing all three of them, many of which we're probably going to discuss this morning, and if not this morning, well into the future as we come with you each and every weekend and sort of hearkening back to one of these three. No matter what therapy I talk about on this show, you should be able to fit it nicely into one of these three categories at all times. It's my overall plan. It's my guiding component as I put treatment plans together. And it's my checkoff list that allows me to begin to determine when we're reaching that optimal health stage. Of course, we meet far from that mark. We spend an inordinate amount of time to get to that mark, and we're looking forward to be able to help you get there as quickly as you can over the time frame. So as I work toward our first break here coming up, and getting you prepared to what's going to happen afterwards, I'm going to break each three of these down and get very specific about what it is that we can and do to be able to assess them, the scientific elements out there that allows us to feel very reassured that the assessment was accurate, and then how we march along over time to watch you leave the afflicted state and move to the healthy state that you would like to have turned to, and the reason why you came to see me to begin with, actually. So when we return, we're going to be talking about the deficiencies. How about foods? After all, they are how you're supposed to be getting your nutrients. We're going to talk about whether or not that's really possible. We'll talk briefly about supplements and how it might be that they'll help you achieve that goal. We'll talk about getting rid of those toxic elements as we return after our news break and continue for the rest of the hour. Be right back in a moment with the Weekend Wellness Workshop. Hey, good morning and welcome back to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you today on a Saturday morning, bringing to you concepts we hope that will be helpful to you in moving toward optimal health. Now, we are today discussing what I refer to as the plan, and it's that first initial step that I've got to take in meeting any new patient to try to figure out how best to help them, and I really must determine where we stack up with their deficiencies, their toxicities, and then map out a way to reperfuse tissue that hasn't seen a blood flow in a long time. You'll see what I mean as the morning marches on. I'm going to break down each three of these components now and take a little bit of time to be specific about how it may be that you can start dealing with these particular on your own, and describe too how it may require some sophisticated help to get this completely accomplished. Let's take this first thing about the deficiency states. Obviously, your diet is and has become what it is and what it's become. And you have accrued your tastes and your likes and your dislikes over an entire lifetime. Now, because you have not had the perfect diet, I think every single one of you would agree, your nutrition and your diet is going to play a large part in how you can help us return to optimal health. But I probably should start off this conversation by making a bold statement that I think is a fair one. And that is, you will not be able to correct your deficiency states with diet alone. You can now eat as healthy as one could eat, but at this particular stage of the game, the nutrients available to the very foods that you may select aren't even possible anymore. So what do I mean by that? Well, they'd say that one apple that you would have eaten in the 1950s would require at least 20 apples to be able to supply you with the same nutrients as the apple of today. Now, these two apples would look alike. The 1950 apple and the apple from 2015, in appearance, they appeared to be equal. In taste, they more than likely appear to be equal. But in their nutrient potential, the apple of today, as well as how about filling in the blank, the tomato of today, the cabbage of today, the carrot of today. The list goes on and on and on. The nutrients that used to be able to be provided by eating a good diet aren't obtainable anymore. You will not be able to say that I eat a wonderful and healthy diet, and consequently I don't think I need to do anything else other than do what I'm doing. I don't feel that's accurate, at least in today's world. It may have been true at another time. I don't believe it's true today. So there's going to be a need for supplementation. And by the way, I'm going to be highly specific about supplementation in our next week's show, and I'm going to be describing to you exactly what you should be taking and how you should be taking it. But we're going to move on today to stay in the concepts phase of this, and let's talk about maybe some of the don'ts. I think we could easily cover them today. And if you started out in making these changes in your own household tomorrow, you would go a long way into enhancing the nutrients that you're taking in and the fact that they could be more beneficial with these safeguards than they would be without them. How about this one? And I see this appearing on the nightly newscasts and as many of the publications that I can read. GMO should be avoided at all costs. I know that the body of thinking is that GMO, which are genetically modified organisms, are supposedly helping us in creating a sufficient supply and quantity of all sorts of foods. But in order to get these genetically modified foods, the DNA of those foods has to be messed with. And anytime you mess with the DNA by some artificial means, you're dealing with a Franken molecule, and you have no idea of the potential harm that may result from the consumption of those materials over time. It's a good rule to use to stay clear of GMOs, and one of the few ways you have at your disposal to assure yourself that you'll be able to do that is to eat organically. Eat organic. And by doing so, the rules state you're not allowed to have a GMO food labeled organic. So if you just stay in the organic section of your supermarket, and I watch my own giant eagles nowadays service me very well with organic foods. Eating organic means, by their very definition, keeping you out of genetically modified foods, and you're well on your way in cleaning up this diet just by the removal of those chemicals and tampered with DNA of the scientific community of today. Of course, the foods come in 3 packages. There's only 3 foods, no matter what you put in your mouth. It's either going to be a carbohydrate, a protein, or a fat. Those are the foods. There are no others. I'd have to say that in this day and age, it's the carbohydrates that really need to be curtailed and monitored pretty carefully. We have moved into a generation where the disease on the horizon that looks like it's going to overtake our children is going to be diabetes. Diabetes is rampant now, and it will become even more rampant as time moves on. This is a carbohydrate derangement, pure and simple, due to the assault of our food industry on us over many years. So lowering the carbs is my general rule to all my patients. That then means your diet better contain an adequate amount of proteins and fats. These are the 3 kinds of foods that there are: carbohydrates, proteins, and fats. And if I have to put a plug in for any one of the 3 that's the most important of the 3, I may surprise you, maybe not, that the most important of the 3 are the fats. And this is the one that appears to have a negative connotation in our world. Somehow fats got a bad name a while back. Fats are harmful, so we were told. We were to avoid fats. We developed grocery cases full of non-fat, low-fat, zero-fat. The worst possible thing that could have happened was for us to remove those fats, because you must have an adequate supply of the appropriate fats every single day to replenish the need that's being demanded the previous day. So carbohydrates, proteins, and fats will be how you receive nutrients. Fats are the ones we'll spend much time in the future talking about how sophisticated fats should get and which particular fats you'll need to be looking for. Okay, toxicities. There are toxic elements that you're a Pittsburgher, you're Western Pennsylvania. Where do you think you live? You live in a cesspool of environmental toxins that in days gone by, for sure, we couldn't see our hand in front of us. That's a long gone time era, but nonetheless, we still have quite a few toxic elements in our air, in our water, in our foods. We're most concerned with heavy metals, and we are going to be discussing up and coming how you particularly get rid of heavy metals. I must get rid of these heavy metals. They do interfere with the normal functioning of tissue, and so consequently, getting rid of those toxicities is a large part of my job with each and every patient I meet. There also are non-metal toxic substances, and we need to get rid of those too, because to unburden the tissue from those toxic elements allows the tissue to function normally, where they would never function normally with them. So, toxic substances, how to remove them, whether or not I should use chelators, and in this case I'm talking about chemical chelators, and I rarely need to use them anymore. There are some natural chelators that allow me to remove these metals, and I'll be talking to you about them in the up-and-coming shows also. Now here's what I'd like to do. I'm going to take a final break, and when I come back, I'm going to close out that last segment with that part of the three-legged stool, the three-pronged approach, the perfusion part that I feel everybody misses. I'm going to spend an entire segment talking about how to optimize your perfusion when we return. Be right back. Hey, good morning and welcome back to the Weekend Wellness Workshop. I'm Dr. Dennis Courtney with you today on this Saturday morning show. We're here at 10 o'clock on Saturday mornings. We're talking about how you ultimately can attain optimal health. I believe that a medical doctor with alternative potentials and utilizing the alternative realm is able to get you there where the conventional medicine doctor cannot. We're talking today about the plan and how it emerges, how it begins with each and every patient in my office. And this three-pronged approach is a staple item that we return to each and every time I meet a person for the first time. Discussing the deficiencies in general and the toxicities in general have been achieved up to this point. I want to take this last segment to talk about the arena that might be a little strange to you. I don't think you were shocked by a discussion of deficiencies, nor do I think you were shocked by talking about how toxic substances could harm you. I don't feel that you should be shocked, but you should be interested in learning how to optimize your perfusion, that blood flow that you need to act as the medium by which nutrients can get into an area and toxic substance can get out of an area. When that's optimal, your ability to do the previous two things will also be made optimal. Now, I say there are two ways to substantially improve your perfusion. Okay, maybe there's three. If we say exercise, a nice, steady, healthy dose of exercise every day can absolutely increase your ability to perfuse areas of your body. I'm not going to be down on exercise, but I need to bring to the table that which as a medical doctor can really be something new and never thought of before. And there are two ways that I optimize perfusion in my office. The first way is the use of a procedure referred to as ECP. By the way, those are letters and an acronym for external counter pulsation. And the second device and modality is the use of a procedure referred to as, well, the realm is PEMF, which is pulsed electromagnetic fields, but the particular device used is called the beamer. Now let me tell you about these two things, which I believe have allowed me to maximize perfusion in all of my patients 100% of the time in a very substantial way. Let's take the first of these, external counterpulsation. Do you know that there is a procedure? It's FDA approved. It's insurance covered. And I defy you to find it here in Western Pennsylvania. A device that's been available since the 1980s. And I should also add that the one place I'm sure you're going to find it is on the 7th floor of Presbyterian Hospital under the care and direction of a cardiologist by the name of Dr. Özlem Saran. Now, Dr. Saran is a female cardiologist from Turkey, but I mention her because just about every bit of research on the use of ECP comes out of the 7th floor of Presbyterian Hospital here in Pittsburgh. And it must bypass all of us and go to the rest of the world because we don't know a doggone thing about this ECP. External counterpulsation is a device that allows us to literally squeeze the legs in synchronicity to your heartbeat, literally taking all of your blood from your waist down and forcing it above the waistline at each heartbeat. That is a phenomenal amount of blood, ladies and gentlemen. That's greater than half of your total blood volume being pushed up into the central circulation at each heartbeat. And so if you have a heart rate of 72 times a minute, this device cycles and shoves that volume of blood up into your upper circulation at each beat. Now, that phenomenal amount of blood, when it is felt by the vessels above the waist, the vessels essentially say, what the heck is going on here? I've never seen that amount of blood in my entire existence. So they meaning those bigger blood vessels in your upper torso, attempt to compensate for this onslaught of blood in the only way they know how. They secrete a hormone. The hormone has a name. The name of that hormone is called VEGF, and VEGF stands for vascular endothelial growth factor. And under the influence of that growth factor, and now here comes the crescendo moment, you grow a brand new set of blood vessels around every structure that you own. Blood vessels you didn't have before. Brand spanking new ones. Each and every time you jump off that ECP device. ECP has been a staple item in my office for 15 years. I can't answer you why you can't find this procedure in Western Pennsylvania. All I'm doing is telling you that you certainly can find it here with me, and that my patients routinely become involved with ECP and allow their insurance to cover the reimbursement for it. It's been a wonderful procedure. You're approved, by the way, for 35 treatments of this, which you do 1 hour a day, 5 days a week for 7 weeks. It's like a job. But at the end of that job, a benefit is extended to you that you can get no other way. So we'll have a special show on ECP. We'll talk more about it, but it's absolutely a way that I increase perfusion to areas of the body that have not been able to achieve it up to this point. And you can exercise. You can run a marathon from here to Boston, and you can't get as much circulating blood around your body in the entire run that you can get around your body in 1 hour with ECP. That's how potent it is. Now, the other device that helps improve perfusion is this thing called the beamer. It's an electromagnetic fields device, but in using it, we're able to optimize the perfusion in the blood vessels that you already have to a degree that they've never seen before either. And for an 8-minute treatment of a beamer, and the treatment consists on lying on a lazy boy recliner for 8 minutes, you're able to perfuse all aspects of your body for at least 16 hours beyond that 8-minute exposure with nothing but good things to come from it. You combine ECP, which is the ability to create new blood vessels, with the ability to perfuse the blood vessels optimally through the use of a beamer, and an 8-minute session sitting on a chair, you have now taken your blood flow to levels that have never been achieved before, and over time we'll be able to have a sustained blood flow to those organs, allowing the three-pronged approach to work optimally. Because with that blood flow, there's no doubt that when I want to get nutrients into crooks and crannies that haven't seen a blood supply in a while, I'm going to be able to do that. By the way, we talked about eyes earlier in the show. We talked about eye diseases that we treat. And if there's one crook or one cranny that demonstrates the ability of tissue gone awry, it's things like, how about this? Macular degeneration or glaucoma or cataracts, which are the epitome of a disease of the aging where all three of these factors come home to roost. You lack nutrients in the retina of the eye, you get toxic substances in the retina of the eye, and you will not have a perfusion over time to the retina of the eye. That eye will not perform well. It will become dysfunctional. It will cause you a problem. And how would it be then that we could rescue you? We've got to provide you with the deficiencies you lack, remove the toxicities, and restore an adequate blood flow once again. So what happens at the eye can happen everywhere. Every organ has the ability to be optimized by the use of those three components. I'll be talking about those three components in roundabout ways each and every week that we meet here, but I thought we should start off by just laying out the plan in its specifics and its generalities on today's show. Those baby steps will add up, and it will all become revealed to you, and you'll have that aha moment where it all makes sense. Now look, I'm looking forward to being with you next week, and next week's show is going to be what I believe the next baby step should be. It's the most frequently asked question in my office. I open the door, the person comes in. By the way, he may be a real scary-looking patient. Why is he scary? Because he's standing at my doorway with 2 shopping bags. They're both filled to the brim with every single supplement that person could buy. And when I see it happening, I say to myself, he just doesn't get it. We got to have a sensible way to supplement. Supplementation needs to be described specifically by your doctor. I plan on tackling that one next week when I answer the question, hey doc, what do I take? That question's been asked of me by every patient, just about, over 20-year experience. And let me reveal something to you that maybe you wouldn't expect me to say. For 17 of those 20 years, I refused to answer the question. Got to be a reason for that, huh? I'll explain why I never answered it for 17 years, and I'll also explain why I answer it now. I'm quite specific about what supplements to take. So it's the next baby step for us. Should you have an alternative doctor? Well, you're going to be making that decision. If you see one, you can expect that they should be dealing with deficiencies, toxicities, as well as perfusion. And you know that you can't correct your deficiencies based on diet alone. You're going to have to supplement, and somebody better be showing you how to do that supplement in the most common sense way. That's probably the word I want to leave you with. Common sense way. I personally, if I went to my breakfast nook every morning and had to look at 20 jars of supplements, I don't think I could quite handle taking 20 M&Ms, let alone 20 tablets or 20 capsules or 20 of anything. This has to be made sensible, and I think next week I'll be able to do just that. So enjoyed having you with me today. Hope you enjoyed hearing about some of the things we do at the Courtney Wellness Center out here in McMurray. You may want to give us a call at 942-3002, scheduling an appointment to see me face-to-face to allow me to put into play that which I'm describing for you right now. Also, for those eye disease-afflicted individuals, go to the Pittsburgh Eye Protocol, find out what we do. We have these up-and-coming treatment programs. I will be talking about them more in very specific terms in up-and-coming shows, but I thought I'd bring that to your attention now. If your vision is failing you, learn how to reverse it in 3 days, and we'll let it go at that. So we'll see you then. Till then, Dr. Dennis Courtney saying so long.